Hi friends, this is Dr. Apurv Mehra and I am representing the team of Conceptual Orthopedics here. Our aim in the new series that we are starting with is to create a beautiful two-way interaction between the students and the teachers to understand how to diagnose and present a case. So what are we going to do? We are going to give you cases from all the different spectrums. For example, if I look at trauma, all right, we will be having areas like elbow deformity, post-traumatic, or elbow deformity with a nerve injury, only elbow deformity, or an only nerve injury. So that is what we want to get to you. We might get you cases of stiffness around the joints, all right. We can also get you cases of non-union after trauma. You know, when I look at my tenure in post-graduation and beyond, hip was very challenging to me. Brachial plexus were very challenging to me. So these are two areas which if I had to present, even if I have to present today, you know, I can fumble. So we are getting you what? We are getting you a case of brachial plexus palsy, where you can have an interaction with the seasoned examiners who are known for their clinical skills, not only to diagnose, but also to teach, along with a case of hip. You know, hip has got so many things. It's actually a ball and socket joint और सब गोल हो जाता है एग्जाम में. So this is what we are trying to do. Ask the teachers, right? What we say is prepare in the peace for the war so that you don't fumble in the war. So this is what you have to do. Prepare here in this month. In this month of August, get ready for all the exam for next 2-3 months for all the variety of cases. We are not going to stop at trauma, you know. When we look at sports injury, you will not have any exam today without a case of a knee instability or shoulder instability, very commonly asked. Ask the examiners what all are the significant tests and the pointers to be asked and discussed. Then infections. You are living in this country, so you will always have cases from different areas. Infections of the elbow, infections of the wrist, infections of the spine. You know, we don't have one, we have in fact 2 cases of spine where you can interact with the teachers. And then again, we had a traumatic, post-traumatic hip, we have an infected hip. So we have all the spectrums that can be discussed. Further, if you go ahead, growths, you know, growths are something, if there's a growth in the ward, it will be kept in the exam. Growth where? Rear area, scapular growth. Growth where? Lower end of the leg. Growth where? Back of the knee. So these are the things where not only your diagnosis, but also your relevant anatomy will be tested. So examiners are going to talk to you about all this. And then again, ankle, one more, lower end of leg. Congenital deformity, pediatric cases are going to be full. And we'll make sure just the best teachers interact with you on these cases. Congenital, foot deformities, unilateral or bilateral, or something to bilateral scapular dystrophies. So these are the important areas where you have to get ready. And then, you know, post-COVID, we have seen that you have some developmental disorders around the knee or the elbow that are being seen. And this is one of such examples. So get ready, friends. Let's meet together, discuss the cases, clear our concepts. What do you need to do before you present, right, to the teachers online, right? Read the book given to you, Concepts of Clinical Examination. If you prepare that particular area well, I am very sure the interactions are going to be more fruitful and the learning is going to be better, because, you know, every time you ask your doubts, right, you learn more. The learning should never end, and this is the best age to learn. Learn better in the beginning so that you have a good base on which you can build up a beautiful pyramid. So we welcome you to the clinical case discussions over this month, right? We have lots and lots for you. Are you ready? Thank you very much.